Hi, I'm Matt Goldberg, and this is going to be my motor exam for St. Petersburg College Health and Assessment course. It's going to be done on a 35-year-old female, Caucasian. Hi, my name is Matt. I'm going to be your nurse performing a motor exam head to toe today.
Hi.
Okay?
Okay.
All right. We'll start off by assessing the patient's cognitive status, mental status. First thing I want you to do is, can you tell me your name?
Teresa Westcott,
Okay, and what year is it?
2015.
I had to think about that. Okay, all right, and where are you right now?
In the hospital.
Okay, what city?
Daytona Beach.
Okay, all right, and to assess your cognitive abilities, I would like to see if you can count by sevens, starting at 7, working your way up.
7, 14, 21, 28, 30, 6,
35.
35.
Close. Okay, I think you're pretty good.
Okay.
All right, so the patient is A&O times 4 or 3, depending on how you do it, and a GCS of 15, and she's able, her cognitive abilities are good. All right, so we'll move on and we'll do our skin, hair, and nails assessment. So we'll start off with skin. We'll inspect the patient's skin, see that it's good. It's good, it's warm, dry, and has good turgor and pallor at this time. All right. All right, and it's all uniform, and nothing stands out at this point abnormal. We'll move on to hair, and the patient has long brown hair, and we're looking for dispersion on the scalp and coverage. It's good, it's covering all parts thick. This patient has soft brown hair, and it appears to be very healthy and clean and well kept. So we'll move on to her nails, and looking at both her hands and her feet. Patient looks like they're even, smooth, healthy, with a uniform pink and whitish colored nail bed. Cuticles appear healthy on all fingers, and they're well trimmed and cleaned as well. And moving on to the feet, find the same. Although toenails are painted red, you can see that they are healthy and clear and smooth, and they all have a uniform quality as well. And she has good capillary refill, less than 3 seconds in all toes. We'll move on now to the head and face. So looking at her face, we're just inspecting first, and we see that she has symmetrical features on her face. She appears healthy, nothing abnormal, is anything bothering you at all? Have you ever had any issues? No?
No.
Okay. So nothing of note. We want to then palpate and see if there's anything that stands out. Nothing, no bumps, lumps, anything to be concerned about. It's all even. I'm going to have you tighten your jaw for me, like biting down. All right, and we can palpate the masseter muscle, and it appears to be working well. The next thing we would do would be test her facial sensation, see for the facial nerves, and to see if she can differentiate. All right, you feel that on there?
Mm-hmm.
Right
Yes.
there. All right.
Yes. Yes.
And that feels even and the same on all parts of your face that we touched?
Yes.
Okay, that's good. Okay. All right, so I'm going to have you smile for me. All right, frown. All right, very good. All right, can you lift your eyebrows up? All right, look surprised. All right. Very good. Okay, so testing the facial nerves and to see if everything's moving equally and her face is moving symmetrically at this time too. Moving on, we'd like to inspect the patient's vision to assess it, and we find that first we would need a Rosenbaum card, which we were unable to obtain for this, but we would hold that in front of the patient's face to assess for nearsightedness, her vision abilities, and ask her to read off the card, see which is the lowest, smallest line that she could read off of, and assess from there. So at this time, we're going to check her ability to see like her peripheral vision. So I'm gonna have you cover your left eye. All right. All right. And tell me when you can see my finger coming in.
Mm-hmm.
All right.
Yep.
All right.
Yep. Yep.
All right.
Yep.
All right. And then if you could switch eyes for me. Okay.
Yep. Yep.
Okay.
Yep.
All right.
Yep. Yep.
All right. Very good. Okay. So now I'm going to inspect the eyes using our light, and I'm going to have you hold your hand just in between. Okay. Let's do that one more time. Okay. One last time here. Checking in both pupils. Her pupils are equal, round, and reactive. They're about 3 millimeters, and they accommodate to light equally on both sides when we tested that. I'm going to have you follow my finger for me with both eyes, just your eyes. All right. Okay. Both her eyelids, there's no lag when she's closing her eyes, and following my finger, which is a good thing. Just check my notes one moment, make sure we didn't miss anything on the eyes. All right. One last thing, if you could focus on an object off in the distance for me.
Mm-hmm.
Okay. And then focus on my fingers. Okay. Her eyes, our pupils accommodated appropriately from the change of vision there for fields of gaze. All right. So moving on from eyes, we're going to go on to ears now. And we're going to inspect those as well with the light. Use scope cover here. Snap that on. It's just straightforward for me. Pull up on the auricle. All right. All right. Her inner ears appear healthy and clean, with tympanic membrane intact, and like we said, everything appears normal, nothing out of the ordinary there. So we can go to the other side. Hope I don't strangle you with this accidentally. We'll do the same thing here. All right, appears to be exactly the same, equal and clean. And noted that they were tympanic membrane was pearly gray in color and looked healthy. So I'm going to have you cover that ear for me. All right, turn your head towards me. All right, and if you could repeat what I say here, if you hear.
1, 2, 3.
Okay, very good. Now we'll do the same on the other side.
ABC.
Okay, very good. All right. And we do have one tool for this tuning fork. And first thing that I'm going to do is I'm going to hit it, it's going to vibrate, and I'm going to place it on the top of your head, and you're going to tell me where you hear the sound, okay?
Okay.
All right. This is called a Weber test, all right?
Okay. Both left and right.
You both heard it both equally on the left and right?
Mm-hmm.
Okay, that's good. All right. Now we're going to do what's called a Rene test. We're going to place it behind your ear, touch, and then in front, okay? And we'll see how long you hear it for. Tell me when the sound starts to go away, all right?
Okay.
All right.
Okay.
All right.
Okay.
Okay, that's good. It was about equal on the right side, which is what you want. You want them to be about exactly the same. Just very slight difference, usually about 15 seconds or so. All right, we're going to do the same on the other side, okay?
Okay.
All right. Moving on from ears, we'll go on to nose and mouth as well, okay? Inspection first. Those appear equal and normal, no abnormalities noted. All right, so we're going to inspect the insides as well. All right, looking into the nose, mouth. The nose, the nares appear clean and symmetrical. Their mucous membranes inside are pink and clean and somewhat moist at this time. Then we'll look in her mouth as well. If you could open wide, your lips appear to be in good health. And we'll look inside. All right. Looking under the tongue and around. We'll inspect the gums and the teeth. All right. Smile. Look at your teeth as well. Good. Okay. So what we noted was that there were no dried or cracked sections of her lips. The skin appeared to be intact and moist. Inside her mouth, her gums appeared healthy, no redness, swelling, bulging anywhere around the gum line. The teeth appeared healthy, and her tonsils as well. Her tonsils were intact and healthy at this time, no swelling noted. Last thing we have to do for her is we're going to want to check to see if her palates react appropriately. We'll have you open wide for me. Okay, say ah for me. Okay, and you can see the palate moves up as appropriate, and her uvula vibrates as we would expect. Place that over here. And last thing we want to check for the tongue. If you could lift it up, all right, down, and if you could move it to one side. Other, checking for any lesions. All right, breaks in the skin, it appears good. Excellent. All right, and you're able to stick your tongue straight out for me as far as you can. Okay, that's midline and appropriate, so that's good. Checking for cranial nerve 12, as well as 9. So everything appears to be appropriate there. So we're going to move on to chest and lungs at this time. Okay. We'll do posterior first, if you don't mind. So I'm going to have you swing your legs over to this side. All right. Okay. I'm just going to swing your hair there for me. Okay. All right. Looking at your back, posterior area of your chest, everything appears symmetrical. Nothing protruding, no prominences to be worried about at this time. All right. And we're going to palpate, see if there's anything asymmetrical that we're feeling. Working our way down. Base here. All right. All right. And one test we're going to do, I'm going to have you say 99.
99.
Okay. Again?
99.
All right. One more
99.
time. Okay. Very good. All right, so while we're on the posterior here, we'll percuss in the area. Okay, not noting anything out of the ordinary. Sounds and feels as it should. Take a deep breath for me. Okay. Everything is appropriate this time. Good expansion. It's equal on both sides. Rate, rhythm, and quality are normal. She's breathing maybe 14, 16 times a minute at this time. All right. Test down here. All right. You'll take a deep breath. All right. feel any tenderness there around your flanks at all when you take a deep breath in and out? We push in there. Okay, nothing. Okay. All right. Auscultate as well. You're going to listen in all areas of the lung lobes here. Take a deep breath for me. All right, she's got good movement of air and it's normal. We have clear lung sounds in all fields all the way down into the bases. You can hear good, like we said, good movement of air at this time. Nothing that would lead us to suspect any acute disease or any other abnormalities. So we'll have you lay back in the bed now. And we'll listen from the front as well. We'll check real quick, feel anything abnormal that we're concerned about. All right, down the chest to the bottom of the rib cage, around the lateral aspect. All right, nothing appears to be protruding or feeling strange. There's no crepitus or any other abnormalities noted at this time, so we will proceed to auscultate. All right, deep breath. Good. All right, again, lung sounds are still clear. We have good rate, rhythm, and quality, good chest rise and fall for her. No excessive accessory muscle usage. If we had something that we were concerned about, we could perform a bronchophony, agophony, or the whispered pectorology test. But at this time, there's nothing to be concerned about with her. So we can move on as long as we're here to the heart and vessels. So we're going to lay you supine for this, okay? We'll just lay you flat. Good. All right. So we're going to be listening for heart sounds in the aortic, pulmonic, herbs, tricuspid, and mitral areas of the chest for those sounds. We're going to look in the second intercostal right sternal border for the aortic. We're going to want to listen with the diaphragm and the bell of our stethoscope to these sounds. We'll start with the diaphragm. All right. In the pulmonic, we're going to check the second intercostal at the left sternal border. Okay, herbs would be at the third intercostal. All right. Tricuspids at the fourth. And mitral is the left midclavicular line, the fifth intercostal space. All right. And normal lung sounds at this time using the diaphragm. Before we go to the bell, note that the S1 sound is the closure of the mitral and tricuspid valves. That's what we're listening for. And S2 would be the closure of the aortic and pulmonic valves. And we're listening for those two lung sounds, which are the most prominent. You don't always hear the other sounds, but those are the two that you generally hear on everybody. So I'll move on to the bell. Her heart sounds are as expected, normal. Her rate is definitely between 60 and 80 at this time, just from counting. Now we're going to check for some pulses. We want to palpate and then auscultate both the temporal and carotid pulses at this time, so we can sit you actually up a little bit if you'd like for this.
Sure.
All right. Probably a little more comfortable. Thank you. All right. All right. Temporal pulses are good and strong, so we will auscultate those. Sorry about that.
That's okay.
Okay. And palpating a carotid. Good, strong carotid pulse on both sides. No signs of any abnormalities there as well either. No bruits or any other abnormal sounds we'd be looking for at this time. While we have the patient in this position, one thing we missed was inspecting the neck of the patient earlier. So we can go back and do that while she's here in this position. So we'll start by palpating, inspecting, seeing if there's anything abnormal. Doesn't appear to be anything. The patient's neck, it's symmetrical, feels even and normal all the way around. I'd like to inspect the trachea to see if there's any deviation. Okay. Alright. I'm sorry. Alright. Trachea is midline at this time, it moves normally. Alright. And one thing we'd like you to do would be to go ahead and take a hard swallow for me. Okay. Alright, that moves normally. Try one more time for me. Alright, good motion of thyroid there and the trachea normal as we'd expect. Now we're going to palpate lymph nodes. Start all the way at the back. Work our way down. Any tenderness here that you're noting? No?
No.
Okay, all the way down. Alright, try here in front. Any tenderness there? Alright, what about behind? Okay. Alright. Feel anything under here? Any tenderness or swelling that you're noting? No? Alright. All the way down. Nothing noted abnormal feeling. Nothing painful?
No.
Alright, so one more time here in this area. Work our way down. That seems normal. Feels normal, nothing swollen and it's all symmetrical on all sides. Okay? Alright, nothing bothered you there?
No.
Okay. Alright, so one more time we're going to lay you flat. We're going to move on to the abdomen at this time. Alright, so we'll just lay you back over here. Okay. Inspecting the abdomen, first thing when we're inspecting, we'll check the area, see if there's anything that seems asymmetrical or of concern, nothing protruding, nothing pulsating. You can see an apical heartbeat there in the upper area, just below the xiphoid process. So we've inspected, so now we're going to auscultate at this time, listening for bowel sounds. Patient definitely has active bowel sounds at this time in all four quadrants, which is what we would hope for and expect. So the other thing we're going to do now is percuss to see if there's any abnormalities in sound. So you'll just feel me a slight tap, okay? Was anything painful there? Did you feel anything at all? Okay, good. So nothing painful there. It all sounded and felt normal. So first thing we're going to do is a light palpation, okay? You're going to feel this touch. Let me know if there's any pain in any of the areas, okay?
Sorry, I'm tickling.
All right, it's good to know.
No pain.
Great, nothing painful then. As long as you're laughing, I think we're okay. All right, so we're going to feel, we're going to do a more deep test now, okay? I'm going to push a little deeper and let me know if it's painful at all. Try not to laugh.
Sorry.
It's okay. Better than crying, I suppose. All right. All right. We're going to feel up here while we're palpating to see if we can note the aortic pulse where it's descending out of the heart there. We can definitely feel an aortic pulse, but it's not like a pulsating mass or anything that you'd be concerned of at this time. We're going to feel on the posterior aspect to see if there's any kidney or liver swelling or any issues as well there. You have any issues here? You feeling any pain?
No.
Right, what about when we go up there and push? Nothing? Okay. Okay. You said no pain at all, so this appears to be a normal, healthy individual with a normal abdomen at this time. Just check our notes, make sure we didn't miss anything. All right, so moving on, we'd like to do move on to the musculoskeletal system, okay? So we're basically going to be looking at all your joints at this time, seeing if there's any edema or any other abnormalities, crepitus, anything that's bothering you. Have you had any issues with your joints at any time? No?
No.
Nothing lately either?
No.
Okay, so we'll inspect all the joints moving down. Inspect and palpate as we're going down. Everything appears normal, no swelling or abnormalities noted. They're all symmetrical in appearance. So first thing we'd like you to do is I'm going to sit you up. We'll do the hip, okay? So we'll sit you up for that. Perfect. So I'll have you stand up here on the side of the bed. All right. I'm going to have you swing your one leg out to the right. Now bring it back. Now move it out forward. All right.
Sorry.
Back.
I'm just not balanced.
It's okay. I understand. I'll move it behind you as well. All right. Do you have any pain or issues with that?
No.
Okay. We do the same with the other leg. Move it out to the side first. It's all right. And then back in. And then forward. All right. And all the way back. Okay. Good. All right. Good. So that's good for the hip there. All right. No pain there that you've noted. So we'll have you sit again. And we're going to do your neck now. Are you able to lean your neck all the way forward? All right, and all the way back? Okay. Any pain or difficulties there?
No.
All right. I'm going to have you push back. All right. And then forward against my hand. All right. Good. Good strength. No pain there when you're trying to do that. All right.
No.
Can you lean it all the way to one side and back to the other? All right. Now I want you to turn towards me. All the way as far as you can. Now turn the opposite way. All right, now we'll do that with against pressure. Okay. All right, any pain or difficulty doing that? You feel restricted in any of those movements?
No.
Okay, that appears normal too. So we'll do your shoulder now, okay? We'll start with the right side. All right, move it up. Can you move it over there? Yep, perfect. Out to the side. And turn your wrist while you're doing this. Is there any pain or difficulty, restriction? Go behind your head and down your back a little bit as far as you can. That's perfect. Okay. We'll do the same on the other side. The left side, come up there, go out to the side for me. Perfect. Turn your wrist. All right. Now come up over your head. All right. If you can bring your hand down behind your back as you did before. Perfect. Any pain or difficulty in movement there? No restriction? Okay. All right. Now we'll move your elbow as well. If you can hyperextend it to there, that's perfect. All right. This appears normal. Slight hyperextension in this patient. So we'll bring it all the way back. All right. Good. Turn your wrist while you're there. All right. Any difficulty movement at all? Any pain in the joint?
No.
All right. No crepitus or anything or abnormality is felt at that point either. We'll do the same there. We've got it extended. Turn your wrist for me. Perfect. Flex it back towards you like that. Move. And no difficulties or anything at this time there either.
No.
Okay. All right. Have you flex your wrists for me? All right. And down. All right. And you can turn them about. That's good. All right. Any difficulties? Okay, now we're going to do that with your fingers, all right? All right, I'll have you move all of them at this time. All right. That's good. Okay, any pain or difficulty swelling
No.
in particular? No?
No.
All right. We said earlier, good cap refill, fingers appear normal, symmetrical. All right, any difficulty with your hands
No.
at all? Now you can make a fist for me. All right. go out, fully extend. Good? Okay, perfect. All right, we'll move on to your knees. If you could bend your right knee up for me. Okay, perfect. Now if you could bend your knee, bend your leg across there. All right, is there any pain there noted at all?
Mm-mm.
Okay, if you come back here. All right, we'll do that with the opposite knee as well. All right, there. All right, and just bend it straight up there. That's good. All right, any difficulties or pain?
No.
Okay, good. All right, we're gonna check your ankles now. You appear normal, no difficulties there. Forward. All right, now against resistance if you don't mind. That's perfect. And if the camera can't see this, I'm having her push her feet down as though she's stepping on a gas pedal and now pull them back against resistance at this time. No difficulties there. Okay. I'm going to have you stand one more time. Sorry to ask you to do that. We could have done this before. I'll have you stand there. We'll check your vertebral column. If you can go ahead and, there you go, lean all the way forward. All right. Spinal column appears normal and symmetrical. It's straight up and down at this time. Good. Any difficulties? No bony prominences. There's particularly protruding. All right. Go ahead and lean back for me. See how far you can go back. There. All right. Good. Now lean yourself to. All right. Don't lose your balance. If you could lean to the one side, you're to the right first. All right. Now try the left. Okay. Good. All right. You can have a seat one more time on the bed. All right. All right, so your musculoskeletal system appears to be intact and normal for you. So we'll move on to your neurologic system, okay?
Okay.
I'm gonna lay you flat for this, just, and we're gonna test your sensation, okay?
Yep.
I'm gonna touch different parts moving down your body, and I want you to let me know if you can feel a sharp sensation or a dull sensation, okay?
Okay.
Hopefully it won't hurt too much.
Okay.
Okay. All right.
Dull.
All right.
Sharp.
Okay.
Dull. Sharp. Sharp. Dull.
Very good.
Dull. Sharp. Dull. Sharp.
Okay.
Sharp. Dull. Dull. Sharp.
Good. Move down to your legs, okay?
Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp.
All right.
Sharp. Dull. Dull. Sharp.
Okay. All right. Good. Very well. So now we're going to check different areas of your body with the tuning fork again. You're going to feel the vibrations, okay?
Okay.
And let me know where you feel it, okay?
Yes.
All right. Just there.
Right there.
Okay.
Through my hand and up my fingers.
Okay.
Just that finger all the way up and down.
All right. Check on the other side as well.
Just through my hand.
Okay.
Whole finger.
Okay. All right.
Just the knee.
Okay. Sounds tricky.
Knee.
Okay, good.
Just that area.
Okay.
Oh, all the way through the toe.
All the way through the toe?
Yeah.
Okay, good.
Go up the foot.
Okay.
The whole toe.
Okay, good. All right. While your eyes are closed, we can sit you up a little bit here. I'm gonna have you keep your eyes closed, and if you could open your hands. All right. I'm gonna put something in your hand. I want you to tell me what it feels like to you, okay? While your eyes are closed.
Feels like keys.
Very good. And you're gonna feel me write something on your palm,
Okay.
all right? And tell me what you think it is, okay?
Okay. 9.
Very good. All right, we'll try the other side too. Very good. All right, have you open your eyes? Reaccommodate to the light here, okay? We're going to do a test of your coordination at this time where you're going to be placing your finger on your nose, index finger, and going, all right, and touching, basically, I'll have you touch my finger as it moves, okay? All right. You ready?
Mm-hmm.
All right. I'll have you cover the one eye for that first, okay? All right. I'm sorry. Sorry, go ahead. Touch to your nose. All right. You see my finger here?
Mm-hmm.
Go ahead and touch it. All right, now back to your nose. All right. All right, back. All right. Okay. Now. Okay, back to your nose. All right. Now have you try that with the other side. Okay. You touch your nose to my finger. All right, back to your nose. All right. Good. Good. Very good. Good. Okay. Good. All right. So your coordination is good. Last thing we have to check, we're going to do tendon reflexes with the reflex hammer now. Okay? All right. All right. So first thing we'll do is go ahead and check here in this area, your brachial. All right. I'm going to actually tap my finger. See if you feel. All right. Try one more time. Okay. Good. All right. Do your tricep now too in this area. So have you hold your arm there. Very good. And all right. Very good. Check this area as well. Okay. All right. Good.
Mm-hmm.
All right. Move to the other side. Do that arm as well. Brachial again. Very good. Okay. And have you hold your arm out again like that. All right. Gently the arm. Get myself that time. All right. Okay. So this time, well, we'll have you sit on that side of the bed, dangle your legs over the edge.
Okay.
All right. Just relax them, okay?
Okay.
There. Okay, good. Okay, very good. All right. I'm going to tap on the back of your ankle as well now. It's just your Achilles. Good. On the other side, just staying relaxed. All right. And I'm going to have you kick your feet back up in the bed, if you don't mind. Bed's coming apart. All right, so we're going to test the Babinski reflex on the bottom of your feet. You're going to feel me dragging, okay? Just relax them. All right, good. A little expansion there. All right, good. As we expected. All right. I'm going to have you sit this way with your legs dangling over the edge one more time. Test your balance here, okay? All right. All right, good, you got it. All right. Sorry to surprise you. Okay, we're going to have you stand up and do a Romberg test, which is basically you put your feet together for me, arms at your side, take a deep breath and relax, okay? All right. Stand up good, you have good balance. Now I want you to close your eyes, just breathe normal and maintain your position, okay? Okay, good. All right. You have good balance. All right.
Right now I do.
Yeah. Excellent. Okay, so I'm going to have you at this time, we're going to assess your gait.
Okay.
So I just want you to walk that way, a few steps, good, and turn and come back. Good. Now we're going to have you do it heel to toe, okay? Do the same way out and then back, all right? On your way out and then back. Excellent. Now, if you're able to, if you could walk just on your heels with your toes lifted off the floor, if you could walk out that way, and on the way back, if you could walk just on your toes. Very good. All right, and I'll have you have a seat on the bed, okay? All right. Normally this would complete the motor exam, but we want to review and make sure we've hit all points, so we'll briefly go over all those points for a moment. All right, one more way we can assess your nails is if you could hold them together and make sure there's the space to make sure there's no clubbing noted. Very good. See light on the other side. You can do that with the others for me. Perfect. All right. We'd like to assess your neuro with your hands. If you could hold your hands out like that and touch each of your fingers to your thumb. All right. Very good. Okay. And as we noted when looking at your eyes earlier, they are a blue-green color, okay? And, yep, very good. Your pupils are black as expected, and your iris is, like we said, the blue-green at this time, and they are equal on both sides. Your sclera is white, and we would look at your eyes and expect to see the inner canthus. So it's moist. There's some reddening. They're moist. All right. Very good. Good range of motion in all your joints. All those. Do you have any questions at this time? All right, I think we hit on all points. It's pretty much a complete normal motor exam for you as a patient, okay?
All right.
So Matt Goldberg.